specialities are being introduced worldwide, and there are possibilities that they may also be recognized as separate specialities in Pakistan Medical Commission in future. So those specialities include endodontics, geriatric dentistry, dental implantology, primary care dentistry, speech pathology, dental dentistry, oral and maxillofacial radiology, forensic dentistry, and many more. Talking about this, you may find it difficult to make up your mind for choosing any of these options, but there are always reasons for making a decision. So I wanted to share a few reasons for which I chose dentistry and then the specialty of orthodontics, and I hope it will help you decide well. So my first reason why I chose this profession was the love of health science. When we were kids, I remember that when someone used to ask us what we want to become in future, my answer was that a doctor. Although today's young generation has numerous other choices, numerous other options than those which we had at that time, from computer skills to technical management, but the dream of becoming a doctor, a scientist, or a healthcare professional still exists. And it is not only because of the nobility of this profession, but the fact that treating a human body is a very interesting job. So I believe that the primary reason for me to choose this profession was that I wanted to study the science of human body, its treatment, and I came to know that there is a field like dentistry which involves the biology of teeth and jaws, and it sounded very exciting to me. Even later on, when I was choosing my specialty, I again listened to my heart and revealed that I had quite deep interest in studying the beauty of face and smile. So therefore, I chose the specialty of orthodontics. So for you, the foremost principle before you start any specialty is that you need to listen to your heart. When you do so, something which attracts you, interests, it becomes a lot easier to pursue all the challenges which comes along. For all the young graduates, dentists who are in the process of specialty, I must say that get into the specialty which attracts you, which interests you, no matter it's clinical sciences or it's non-clinical sciences. Getting back, my second reason to choose this specialty is the artistic side of profession. Another admirable aspect of this profession is the sense of beauty and artistry. One of our teacher of operative dentistry used to say that dentistry is a profession for those who are doctors and artists at the same time. For those who have keen interests in art, but somehow their parents want them to become doctors, especially the girls. Choosing dentistry itself can be a very good getaway. This is on the lighter note, but as I mentioned, this is indeed a field which involves a sense of aesthetic as well as science. So, and this was another motivating factor for me to choose this profession. The specialities which involves particular attention to aesthetics that include orthodontics, operative dentistry, prosthodontics, and if you believe that you can have interest in aesthetics, then any of the fields can be good choice for you. Thirdly, reason was satisfying outcome. Nothing can be more rewarding than a patient you just treated and relieved his pain and he walks back to you with gratitude and prayers for you. And this is a pleasure which only healthcare professionals can experience. Starting from a procedure as small as extracting a diseased tooth to major dentofacial surgeries, every aspect of dentistry rewards you back with a sense of satisfaction that the patient is in a better state of health and well-being. And as you advance more and more into any specialty, it is not only the end results that inspires you, but the entire process as well. Typically, in orthodontics, we have long treatment durations, sometimes spread over many years. However, when you treat the patient well, with empathy and compassion, it will definitely reward with satisfying results. Remember that the patient does not necessarily have to be to present you to with pain for you to gain his gratitude. Even if you give some time to the patient and listen to his concerns with attention, it will definitely to pay you off with gratitude. Fourthly, the reason of choosing this profession is the sense of community service. Another important aspect of dentistry, like other healthcare professions, is the sense of service, frequently overlooked. As Martin Luther King said, that not everybody can be famous, but everybody can be great, because greatness is determined by the service. So, like all other professions, the spirit of serving community is the main sense which you inculcate within yourselves if you want success. Now, it doesn't mean that you always have to be associated with the clinical industry. Even the specialty of basic sciences can serve by developing new materials and medicines, by coming up with new diagnostic and treatment modalities, because all of this is a team effort, and ultimately it will lead to patient well-being. This concept is also a fundamental basis of research, and almost all of the research programs funded by our Higher Education Commission nowadays, they are based on the objective that how well they'll be benefit the community and humanity. The fifth reason is the ongoing research. This point is it's very important for those who are now in a process of choosing a particular specialty. So dentistry today is not limited to the confines of a dental chair, but it has developed into an industry. And in order to keep pace with the patient's demands and needs, one needs to be part of active research. So it not only means that that you will have to stay in touch with the ongoing explorations worldwide, but also to carry out research yourself. So this holds true for both the clinical as well as non-clinical specialty. So far, all of you who really want to continue their career, you must develop a thirst for new ideas. I really mean it, because you have to read the new innovations and in dentistry and get inspired by others' work. And whatever ideas the flash across your mind, no matter how crude they are, always try to work on them. The last, but not the least, is a good income. The primary purpose of getting into any occupation is to earn. So for the guys, when you go back home from work, your wives will expect a pocket full. Fortunately or unfortunately, dentistry all over the world has become a type of business. And although it is a profession of health, yet the importance of a beautiful smile has surpassed the need of simple healthy teeth. And people They nowadays they are willing to pay exuberant amount of money on their teeth just to be more attractive. So there's a great chance that it may lure a few people to malpractice. But in order to keep a balance between the two extremes, you need to develop a concept of business within your minds. A successful dental practice does not mean that you only focus on your net profit gain. In my opinion, it is rather a balance between quality of the patient care and a profitable income. And you will only develop this if you broaden your imagination beyond your subject. Learn management skills, collaborate with other disciplines, and widen your social contact such that if you want to set up your own practice, it is self-sustained and it is profitable. So, in conclusion, recalling my journey of dentistry, it has been a perfect job for me. And remember that perfection evades the necessity to be practical and realistic. So, I shared with you my personal reasons for choosing this profession as a career and choosing this specialty as it's very close to my heart. And my fellows, they have their own reasons. I hope my talk have enlightened you, your motivation and courage. I thank you all. Thank you very much. Over to the moderators.
Thank you so much, ma'am. A quick review of Dr. Rozina's credentials. Professor Dr. Rozina Nazir graduated from De Montmorency College of Dentistry in the year 1997. Professor Rozina has completed her postgraduate training from Armed Forces Institute of Dentistry and fellowship in orthodontics from College of Physicians in 2010. After the completion of her training, Professor Rozina moved to Karachi, where she served in Dr. Ishratul Ibad and Jinnah Medical Hospital and University colleges, and provide professional care for cleft lip and palate patients, including neonatal resuscitation of facial clefts. Professor Rozina then joined Behriya Medical University and Hospital in Karachi. In 2013, Professor Rozina returned to our twin cities, where she served as an assistant professor in Margala Institute of Health Sciences. In 2015, she was promoted to associate professor in Margala. This same year, Professor Rozina pursued a master's in healthcare professions degree from University of Health Sciences, Lahore, and was also recognized as a supervisor for fellowship training in FCPS and MCPS by the College of Physicians and Surgeons. In 2018, Professor Rozina was promoted to the ranks of a professor, and the following year, 2019, she became a part of Foundation University College of Dentistry and Hospital as Head of Department Orthodontics and Associate Dean Clinical Sciences. In October 2020, Ma'am Rozina took charge as Acting Principal and Dean of FUCD&H, and in December 2020, she was appointed as the first female principal and dean of Foundation University College of Dentistry and Hospital. Ma'am Rozina has numerous national and international publications to her credit and is also a member of Pakistan Association of Orthodontics and World Federation of Orthodontics. Thank you so much for your time, and it was a pleasure to have you on board for this webinar, ma'am. I believe our audience has some questions. Those attending online can raise their hands, and then we will give you an opportunity to ask your question as well. Anyone in the audience over here? You want to ask about
Assalamualaikum, ma'am. Assalamualaikum, ma'am. This is Assalamualaikum, ma'am. This is Dr. Minahil.
Okay.
I wanted to ask specifically about ortho. If FCPS is the only route that you would recommend, or is MDS also a viable option?
Fellowship major clinical degree in orthodontics, but MDS is also an option. You can choose MDS as well. The FCPS, basically FCPS started earlier, and people know more about FCPS. Though for the FCPS, you have to go exam FCPS part 1 and then FCPS part 2. But there's nothing bad if you choose MDS. It's also a good option, and you can have a career ahead. You choose this degree.
Thank you, ma'am. We have a question from one of our online attendees. You can ask your question and unmute. You can kindly unmute yourself and ask the question and introduce yourself as well, please.
039, please.
Okay, we'll move on to another question from the audience. You have to raise it up.
Assalamualaikum, ma'am. Can you hear me?
Yeah, can hear you.
Assalamualaikum, ma'am. I was asking about careers and degrees in medical education. Now, I read that the PMDC, now it's PMC criteria, said that there is some sort of requirement for either diploma or a certificate in medical education if you want to be like an associate professor or something. So is it better, for example, at this stage in our life to get a degree or a diploma in medical education, and would it be helpful for us to get it from here or from abroad? Because in different universities and in different countries, a pathway program to a greater, higher clinical degree is better. And at most levels, we are not eligible for pathway programs in clinical subjects because they require 2 years of clinical experience. So if we take a break and we do a medical education degree and still make contacts and prepare for our ORE in UK or something like that, is it a good route for us, or is getting a medical education degree a good route for us over here in Pakistan at this stage or at a later stage?
Thank you very much for your question. I think this is medical education. Degree in medical education is a very demanding field right now, because it's basically for clinical sciences or for basic sciences. Now PMC has put it mandatory to have at least a 6 months or a year certificate in medical education. Now, if you want to pursue medical education, I think that's a very good option. And if you do it from here or do it from abroad, nothing matters. But if you want to do a degree, then start off with not with a 6 months course. Just go ahead with a master's degree. So that will be a great choice, because we have very few people in medical education in Pakistan, and we require more more doctors or more dentists getting into this profession, so that we can strengthen the health professions education in Pakistan. So I think that will be a great choice.
Ma'am, is it a stepping stone for a further clinical degree? For example, if you can't go straight for an MPhil dent, or you can't go straight for like a postgraduate degree over in a UK setting, and you can get like a pathway program, and you can get admission into a pathway program for medical education. If you do that degree, what job opportunities do you have in other countries in Pakistan?
You're talking about medical education or degree in clinical sciences?
Ma'am, I was talking about it in both scenarios. For example, if I stay with a medical education degree, or if I use the medical education degree as a pathway program, like in many countries, what they do, for example, in the UK, instead of going straight for ORE and going straight for a job after ORE, they do a pathway program, a year or an MSc or something, so that you can get contacts, you can prepare for ORE, you can take some courses over there. And then after that, after getting a job, after getting clinical experience, then you apply for your MPhil dent. So would this be a good option for that?
I think that will be a good option. If you go abroad or in UK, the education in UK is considered best. So you can go there and you can pursue a career, and then you can come back to Pakistan to serve our country and community. I think that will be a good choice.
Thank you.
Okay.
Thank you so much, Professor Dr. Rozina. Our next distinguished speaker is Professor Dr. Azad Ali Azad.
Oh, next time.
Professor Brigadier Azad Ali Azad graduated from Nishtar Medical College, Multan in the year 1989 as the best graduate of the college. Following which, Sir did his house job from Pakistan Institute of Medical Sciences and then joined Pakistan Army. After basic military training from PMA, served at various positions as field dental health professional. In 1991, Brigadier Azad joined Armed Forces Institute of Dentistry for a 2-year grading course in prosthodontics, which was the only available post-graduation at that time. During the entire period, from entering to exit, Brigadier Azad had an impeccable record and stood first in it as well. After that, MCPS was introduced in Pakistan, and Brigadier Azad was the first prosthodontist to qualify for an MCPS degree from CPSP in 1995. In 1997, Sir joined FCPS Part 2 training at De Montmorency College of Dentistry under the supervision of great Professor Tariq Zaman, principal at that time of De Montmorency College of Dentistry. Brigadier Azad qualified for his FCPS in his first attempt and is the first fellow from CPSP as well. In 2003, Pakistan Army selected Brigadier Azad for on-job training, for which Sir went to Marmara University, Istanbul, where he undertook a major course of over 6 months in implant dentistry, after which Sir served in AFID and as a faculty member in Army Medical College upon his return. In 2010, Brigadier Azad was promoted to the esteemed position of a professor. Brigadier Azad pioneered FCPS training at Armed Forces Institute of Dentistry and has contributed to training over 100 fellows and MCPS qualified prosthodontics. Sir Azad has been teaching prosthodontics as Army Medical College in 2012. Brigadier Azad joined MSc Health Professions Education from CPSP and qualified in 2015. Brigadier Azad's contributions to the field of prosthodontics in Army Medical College and CPSP are invaluable. For the last 3 years, Sir is the convener for Faculty of Prosthodontics at the College of Physicians and Surgeons, Pakistan. Sir is the Faculty of Prosthodontics at the College of Physicians and Surgeons. Sir is currently the head of Department of Prosthodontics with implants, aesthetic dentistry, and medical education, being Sir's area of interest. Brigadier Azad is a teacher of teachers for our generation of dentists, and we are honored and privileged to have him as our esteemed speaker today. Brigadier Azad will talk to us on career in post-graduation, and general in dentistry and in clinical settings in Pakistan and abroad, with the narration of his personal journey. Thank you so much for being a part of this webinar, sir. Please welcome Brigadier Professor Azad Ali Azad. Sir, can you hear us?
Assalamu alaikum, Professor Rozina, the moderator and respected audience. Am I audible?
Walaikum Assalam, Brigadier Azad. You're welcome, and we are privileged that you have joined us. Thank you very much for joining us, and I hope the audience will benefit from your talk.
So kind of you, ma'am, and it was a pleasure to be part of this great endeavor. I'm thankful to the respected lady for a very elaborated introduction, Professor Dr. Sanaa Masood for all the coordinations, the moderator who is very intelligently moderating the concerns, and to Professor Jawad Ansari also. He is our mentor, and I have the honor to work in his able leadership for many years at Army Medical College. Thank you, Professor Rozina, for initiating this very important area. Actually, at Army Medical College, we have been doing annual symposium on this concern because young graduates are in need of guidance. They have a lot of knowledge, but at the same time, the practical issues of life, when a graduate comes out of college, even as a house officer, the life becomes different. I recall the great late Professor Mushtaq Ahmed, the author of the biochemistry books. इसी साल उनकी death हुई है. Allah Ta'ala उनको ग़रीक़ रहमत करे. He was a principal of Nishtha Medical College also. When I graduated, he called us and told us that, बेटा, आज के बाद माँ नहीं कहेगी कि आप बेटा पढ़ रहा है उसको डिस्टर्ब ना करो. बाप नहीं कहेगा. The boss will say about the office. घर जाओगे, your wife, your family will have their own demands. But you have to focus onto your profession also at the same time. This is more true for ladies because it's very challenging for them, and we are proud of our ladies because, mashallah, they are proving their mettle globally. And it's very challenging at that stage when they graduate because life afterwards is very different. The paradigms change. So part of your focus has to stay onto your profession. And immediately after graduation or in the final year, you should be very clear what to do and what not to do. मैं इसमें ये भी ऐड करना चाहूँगा कि ऐसी सोचों में ना आए कि अगर ये हुआ तो क्या होगा, मामा से पूछूंगी, पापा से पूछेंगे, देखेंगे, इन चीज़ों में नहीं पढ़ना. Earlier the better. If you are going for post-graduation, you all know that basic sciences will be tested in the Part 1 examination or in the entrance of the MDS. So earlier you do, it's better. Moreover, the life will get more and more responsibilities day afterwards. So in the house job years, you should be very clear what to do. Coming back to Pakistan, we can divide our discussion into three areas: post-graduations, jobs, and working in clinics as a general dentist. If you go about the post-graduations, Professor Rozina mentioned about the FCPS, MDS. I will just like to add, the first MDS in Pakistan was from Demont University College of Dentistry. He was an Indian citizen at the moment. He is in India, he is alive. And he did his MDS in 1926 from Demont. Later on, it was only Punjab University and Demont which was offering a little of the MDS programs. The program was reasonably structured, but unfortunately it was supervisor focused, a bit department focused, and that's all. So if the department, the hierarchy and the supervisor are happy with you, you may get MDS. Otherwise, it was a very challenging thing. People will not qualify it for 10 years. Even they go to the courts, exam would not be conducted. Today, MDS is getting recognized in many universities. It's getting structured. It's improving. It must improve further because healthy competition is the only way to progress. Stagnation must not be there. So MDS is a good option if you have a trust in the university, their education system, your department you are joining, and finally the supervisor, if you have the right aptitude. Sometimes few of our colleagues think, I will join MDS, run my own clinic, do my things, and give part of my attention to the institute. And at the end, I will expect my supervisor would be very kind enough to support me and get me the degree of MDS. That will not happen probably, because the examination systems have been structured for MDS also. If you go toward FCPS, we can talk about some points against FCPS also, but at the same time, FCPS is probably the most well-structured and well-conducted program here. We have problems. Part 1 qualified people are not getting training slots. The curriculum of the Part 1 is not well-structured. The quality of the Part 1 exam has been questioned. Recently, myself and Professor Ghulam Rasool from Peshawar, we were given the task to lay out the new TOS and curriculum of FCPS Part 1. We have done that probably in 2 months' time. The aspirant young dentist will have new curriculum and table of specs to have a structured Part 1 exam in a better way. But having said that, you have a letter of Part 1, you cross FCPS Part 2 training, which is difficult, challenging, but somehow most of the people who qualify FCPS Part 1, they get FCPS Part 2 training. Till today, the senior faculty like Professor Rozina and other in all the specialties, they have discussed, and till today we have not shifted our Part 1 to the subject specificity. So it's good for the young graduates that you qualify Part 1 and you are open for at least 5 specialties in Pakistan: perio, prosthodontics, orthodontics, oral surgery, maxillary surgery, and operative dentistry. When to decide to go into a specialty? I take my audience, the frequent cross conversation is not very feasible to me. I'm not very used to these IT gadgets, but my audience may focus when to decide that in which subject you like to go. I believe maybe 20% of my students, they decide in their final year, before their final year rather, I will go into surgery, that's all. There will be few of your friends, peers, they will say, I will go into that specialty in their final year. But probably the house job is the right time. I will personally recommend, with my experience, that if you have inclination toward a specialty, keep it parking in your wish list, get into the house job, which you have to do, learn your skills, as we say, knowledge, skills, and attitude. So house job is the time when you polish your skills and develop a bit of the attitude in the profession. So during your house job, probably in the initial 6 months of your house job, you have ample exposure to the department in a different way. As a student, you are focused more on books, you are focused more on exam. Finally, it's a tough year. A lot of curriculum is there and a lot of clinical requirement is there. But in house job, 6 months are enough to decide. You should be very clear if you have to go into a specialty, which is that specialty. And here I would like also to share very frankly that don't go for feasibility. कि मुझे ऑपरेटिव के अंदर शायद अपने कॉलेज फौजी फाउंडेशन में ही ट्रेनिंग मिल जाएगी, मेरे लिए बड़ा फिजिबल है, आई लिव इन DHA 1 बहुत करीब है, तो ऑपरेटिव ही कर लेते हैं. It's like marriage. It's your life. You have to go with this profession for your all life. Select it with your own mind, according to your own passion. And when your passion and your profession, life gets easy. So it should be your decision. Whenever the parents have contacted me, a brother has contacted me that my sister wants to do special Part 2 training in this area, what's your advice? I would always say, she is the leader, we can only assist her. She can ask 100 questions, we'll reply, but she will decide in which specialty she should go. Then is the waiting time. Sometimes it gets a year, sometimes 2 years, and there are less than 15% people who are scared that our Part 1 should not expire. Those people can think about having a specialty which is a second choice. But if you can get your Part 2 training in the initial 2 years of your Part 1 qualification, still my suggestion would be focus onto the specialty of your interest, of your passion. FCP's training is available all around the country. As the younger people, they think about their family life, their jobs, settling. So it's mandatory to share that FCP's training, 4 years training, has been divided into two: before IMM and after IMM, intermediate module examination. In the first 2 years, you have to stay from where you started training. After 2 years, you can shift to another place also. So if somebody is from Pindi, after marriage she shifts to Karachi. After IMM, after 2 years, the training can be shifted to that place. We keep on emphasizing to CPSP to influence the provincial governments and the federal government to create more training slots, to improve the quality of the training at the hospitals. But it's an ongoing thing. It will continue. Training slots are less. Part 1 qualified candidates are more. I also take this opportunity to, with all the positivity, to warn my young graduates that Part 1 will get a bit tough from next attempt onwards. It will be well structured. और अगर कुछ लोग अभी भी यकीन रखते हैं कि हम MCQs को सॉल्व करेंगे, जो MCQs का बैंक अवेलेबल है उससे प्रैक्टिस कर लेंगे और Part 1 क्वालिफाई हो जाएगा with a bit of luck. I have been part of that team which made the curriculum. Probably you will need thorough study of the books to qualify Part 1. And that is the way to have a concept of a subject and then to qualify. Still, Part 1 is a mid-level exam. An average graduate with a good effort can qualify Part 1 easily. In Part 2 training, then there are subjects: orthodontics, prosthodontics, perio, maxillofacial surgery. I will invite my aspiring graduates to go to the CPSP website, spend some time on the weekends, see the data. How many fellows are there in the maxillofacial surgery? How many in the prosthodontics? Which are the training centers? Who are the supervisors? So you will have a comprehensive knowledge of that specialty, rather than asking your teachers or colleagues or your seniors कि मैं कहाँ जाऊँ, मैं क्या करूँ. आपके पास background knowledge होगा, data होगा, so you will yourself be able to decide better where to go, in which specialty to go, where the slots are. MDS, as I mentioned, is improving. Universities are under Higher Education Commission, and luckily the Higher Education Commission and PMDC, they are probably the best bridged at this stage. We can have observations onto the system for improvement, but still the HEC was out of our leadership hierarchy earlier. Once I remember HEC asked us, I was part of that team also, to devise the BDS curriculum. We devised it for the 5 years and the PMDC immediately opposed it. Today, the HEC, the domains of the HEC, we are again reviewing the curriculum of BDS. The HEC, Ma'am Rozina is also part of that. The HEC and the PMDC, they are bridged, they are linked, they are synced, I would say, and their domains have been reasonably well defined. And they will be further defined, but they will play their own role. Talking about MDS, when the HEC comes into play through universities, I personally feel in the next 5 years, the role of the MDS will be enhanced. We have a recent experience of India, a neighboring country. The quality of their MDS 30 years ago was poor. I can frankly say it was poor. Before 20 years, it started improving. Now it's reasonable. But still with those MDS, they have been able to establish their people into United States, into America, Canada, Australia, Europe, and even the Middle East. So MDS is a valid degree. It's likely to improve in its structure, its conduct, and in its quality day by day with the involvement of the HEC through universities. FCPS is there. It's a singular honor for Pakistan to have a College of Physicians and Surgeons of that quality, of linkages, and having a legacy. Then we have MPhil programs. Now there are few people who say, I have only 2 years. मेरे पास इतना टाइम नहीं है कि पार्ट 1 करूं और 4 साल के लिए 5 साल के लिए हैंग ऑन करूं, 2 साल के अंदर जो कुछ करना है मैं करूं और फिनिश करूं इसको. उनके लिए MCPS के प्रोग्राम्स हैं. प्रोफेसर रोजीना विल बेयर मी आउट. CPSP पे लंबी डिबेट हमारी फैकल्टीज की मीटिंग में हुई. आई वाज रिप्रेजेंटिंग माय फैकल्टी एंड maxillofacial surgery faculty said we want to get rid of MCPS. The other specialties opposed it and they said this must continue. Maybe with a limited focus, it must continue. So there is an MCPS program available in CPSP in 5 specialties parallel to FCPS and also in community dentistry. The community dentistry MCPS may be able to start FCPS in community dentistry because prevention is a very important part of dental healthcare. I personally feel if we curtail the burden of the disease to 50%, then only we can focus on to quality. Otherwise, our national resources, the chunk of the budget we get out of the meager budget cannot fulfill the requirements of a very large population to their doorsteps. So community dentistry is another area. MPhil in the basic sciences, basic medical sciences, basic dental sciences. NUMS, University of Health Sciences, few universities in the Karachi and Hyderabad, they are conducting these programs. But I will suggest that if you want to go into faculty with the MPhil in community dentistry, in oral pathology, in oral biology, please aim, focus, do an extra endeavor to search for PhD also. Because when you will do MPhil, join a faculty, after 7-8 years, 5-year junior to you, somebody can come with a major degree and become the head of department. If he or she is very kind and nice, respectful to you, you may stay there. Otherwise, you may like to quit and there is no way forward. So in the faculty positions, if you want to go, you should aim for a major degree. And it is said that low aim is a sin. Sky is not the limit. Although PhD is not very popular in Pakistan in the clinical sciences, but in the basic medical, basic dental sciences, PhDs are being offered. I believe the RB Medical College, NUMS, will be offering PhD in material sciences very soon, in oral pathology also. And oral biology at UHS is getting stronger day by day. There are few universities in the Karachi also. Even the clinical subjects, they are offering MSc degree parallel to MCPS on the same pattern. A university in the Hyderabad, a university in Karachi is offering MSc in the clinical sciences. We had at Army Medical College MSc prosthodontics under NUST, which later on stopped. But there's a vast area of general dentistry. We as dentists know that our 60% probably of our patients fall into the domain of the general dentistry, which may be dealt by a specialist, but a very good general dentist can manage them. And the specialist can save and focus their energy onto tertiary care needs of their specialty. So MSc General Dentistry is another area which universities may be starting, and there are short programs also on various aspects of the clinical skills. If somebody wants to go and have his or her clinic, then MSc General Dentistry or short courses with personal study can help him or her to establish their own clinic. The speed with which the knowledge, technology, techniques, and clinical techniques are changing demands that a graduate after house job, if wants to go into general dentistry, has to be part of the CPT programs very regularly, because knowledge is changing, the technology is changing, the techniques are changing. I have been, the dental implants are my area of interest. The Brennemark, Professor Brennemark, late Professor Brennemark started with very long implants. Now with the advancement of the technology, especially involvement of the nanotechnology, half diameter implants, half length implants with the same qualities, same or better surface area, larger surface area with half size are available. Hence, the requirements for the sinus lifting or the nerve repositioning or the bone graftings are being diminished. Flap is not being raised in many cases. Flapless implants are being done. So all the healing is focused for the osseointegration of the implant. This is the way the knowledge, the technology, the techniques, they are changing. And the people who stay in the general dentistry, who want to do private practice, they have to very keenly plan their CPT programs. They may take some guidance, and they should chart out their annual CPT programs, which are the areas, dental materials. If I think the facilitators of this webinar, who are very experienced dentists, including myself, if we talk about the dental material, individually, we don't have the full capacity to know each material in detail. Now, Chinese materials are coming, and there are the first copies which will mesmerize any experienced clinic to feel difficulty in detection. So, CPT program for the general dentist is very important, and the areas of CPT has to be decided by yourself. Medical education, there was a discussion also. Medical education is, although I did it late when it started, but I will recommend the short courses for the young graduates. If you do it, after that, you join a postgraduate program in any clinical subject or basic sciences, you do the general dentistry, you get into a job of hospital administration in a dental hospital. Even that short course of medical education will help you to do your own job easily, effectively, and to gel down into a very good teamwork. There was a question from a audience about major post-graduation in the medical education. They are available. We have more than 50 dental colleges in Pakistan. 50 slots of the principal or the dean are there. May I ask the moderator for the time limit, please? How much time I have?
So you have 5 more minutes to.
Thank you, ma'am. Thank you. So I'll finish accordingly. So major degrees are available. MCPS, MSCs are also available. If you qualify, the 50 positions of the principal or the dean will be held by professors who have medical education background. Then if you go abroad, being a young graduate, you go for ORE, there was a discussion, or you go into the American or the Canadian system. If you have a short course in medical education, rather than doing a petty job in the market, you will find some decent job within the campus. There are so many decent jobs within the campus. You stay within the campus, you work there. On the basis of that, even a certificate course, a minor job, which will support your education, and you stay in a decent environment, comfortable environment, which is linked toward your post-graduation also. So even minor courses will help you to go for ORE or in the initial phase of your establishment on a foreign land.
Couple of questions.
In dentistry, I would just finish in 1 minute. In dentistry, we say the knowledge, the skills, and the attitude are important. And for the young graduates who emerge after house job, they go into any stream. This is the time to develop your professional attitude. That will be based on to knowledge and skills you have got your graduation and the house job. I would say you learn, earn, and return. And there was a talk about reward. After 55 years of age, I personally, with all my experience, I would say somebody will stop you in the corner, hand you an envelope of your luck. It comes to you many ways. So do good, serve well, serve the humanity with empathy, and so many rewards. At least when we leave this world, go into the next world, taskeen kalab ka ikhlas bola jata. With a happy heart, you will be going. And that is the biggest success any human being can have. So best of luck. We are open to questions.
So we'll take questions from the online attendees first. Yes, please, you may ask your question. 02. Baba here.
Assalamu alaikum. First of all, thank you so much for hosting this webinar. I would like to ask Sir about the process of joining the Pakistan Army after graduating as a BDS dentist.
Thank you very much. I'm honored. Pakistan Army, as per needs of the service, announces annual vacancies. Today, an announcement is there. You can go onto the website of Pakistan Army. The dentists are being inducted. You can apply, and there is an entry test, MCQ based, about the profession. It's generally 70% general dentistry and 30% specialties. And then the process of ISSB, the standard organized pattern of Pakistan Armed Forces induction, is there. It's purely on merit and a bit of luck also. There was a time that ladies were banned, Dr. Sanaa may know, to join army because there were so many ladies that ratio which is required by Pakistan Armed Forces, male-female ratio, especially in the operational conditions, was being disturbed. Now it's open for ladies also. Ladies and gents both can join. Today you can apply, and it will depend upon the 5 years hard work, good work you have done in your college, and your general knowledge, then your personality. So if you want to take some tip on that, personality traits which are required by the ISSB, be confident, be firm. They will ask very simple things, but they will extract something out of it which will tell them that after 25 years, in a critical situation, what will you do? I personally believe they have the ways and means to extract that. So be confident, be true, truthful, and go in an enjoyable way. Appear there. Pakistan Army is a wonderful profession. If I'm given a second life, I would like to join the same profession very happily. It's rewarding. It is a way of life, honorable way of life. Financially also rewarding being a dentist. It gives you a lot of opportunities to grow yourself, to groom yourself. I have seen people changing to wonderful human beings, wonderful leaders, and wonderful dentists. So opportunities are there. It's competitive. It's open to everybody.
We have many questions coming in for you. We have an attendee, Rida Shahid. She would like to ask your question.
Assalamu alaikum. Assalamu alaikum, sir. I'm Dr. Rida Shahid, and I'm graduated from Bakai Medical University, Karachi. So recently I got married and I'm shifted to Islamabad. Now I'm thinking to some postgraduate program. So I'm interested in 2 years program. So I wanted to ask you that which program is better in between MSc, MPhil, or MCPS. And as I'm new to this city, so I have no clue then where which university is offering these programs, and so I need some guidance.
Thank you. For MCPS program, you are a bit late. For the MCPS and FCPS programs, College of Physicians induct twice yearly. Few institutes induct once yearly, but most of the institutes, under the guidance of the CPSP, induct twice yearly, once before the end of January and second before the end of July. So you will be eligible for the July induction with the CPSP for MCPS program. So there are 6 MCPS, 5 in the main specialties: perio, prosthodontics, operative dentistry, orthodontics, maxillary surgery, and 1 is the community dentistry. These are 2 years programs. So in Islamabad, there are many places. There are few centers which are not favoring MCPS because Part 1 qualified people, so many Part 1 qualified people are in the waiting that 2 years programs are being neglected there. Second, the MPhil programs, if you are focused for MPhil also, I will recommend you should choose a subject where possibility of PhD in Pakistan, in big cities, Karachi, Lahore, Islamabad, or abroad is there, and you have ways and means to follow it in the future. But oral pathology, oral biology, material sciences, the MPhil programs are there in Pindi, Islamabad also. At AFMP Jamai, Armed Forces Postgraduate Medical Institute, these programs are there. You can go to the website of Armed Forces Postgraduate Medical Institute, and you can see these programs being run under Pakistan Army. And I will also recommend to have a visit of the UHS website also. Few other universities are also starting. So the best thing is to go to the websites of the universities and find which MPhil program is being offered.
Thank you so much, sir. Thank you for your time. We'll take the remaining questions in a while. We have some other guests waiting. Okay. But there are many questions for you, sir. Our audience is very anxious to learn more from you.
I'm honored. The questions, actually, they are half the part of any discussion, because without that, it's not complete, but the moderator has to run the show within the stipulated time. Best of luck. Thank you.
We have with us today Dr. Rubina Mumtaz. Professor Dr. Rubina Mumtaz is a graduate and gold medalist from Khyber Dental College. Professor Rubina also holds a postgraduate Masters in Public Health degree from Harvard. Professor Rubina has worn many hats in her career. In the academic front, she is currently the head of Department of Community Dentistry at Raval Institute of Health Sciences and a supervisor for MPhil in Community Dentistry with Shaheed Zulfikar Ali Bhutto University. In the public health arena, she is a consultant on HIV/AIDS in Pakistan, working with UNAIDS and National AIDS Control Program. She's also the founder and country director of Real Medicine Foundation that provides free primary healthcare to the poor and vulnerable. This NGO also has a research wing that conducts research on the nexus of women's health, poverty, and social exclusion with international universities such as University of Alberta, Canada, New York University in USA, and University of Sheffield in UK. Professor Rubina is also an oral health advocate in 19 schools in the Twin Cities. On the clinical front, she has been running a high-end specialty dental practice in Islamabad for over 25 years. We're extremely pleased to have with us Professor Rubina Mumtaz to share her journey from BDS to Harvard and how these experiences shaped her career and her career path. Keeping in view the current pandemic, we also look forward to Professor Rubina's insights on the current global and national situation and its implications for oral health careers and oral health promotion, primarily epidemiology policy matters for our aspiring professionals. Thank you.
Assalamu alaikum ji. Can you hear me?
I can hear you.
Please tell me if I'm audible.
Yes.
Okay. All right. Thank you so much for inviting me. I am very grateful for the organizers who did a great job in arranging this seminar. And thank you to Dr. Rozina and all the other organizers who are behind this fantastic idea of providing career guidance, which I think is now a real issue considering we are producing so many dentists every year. So I'll just give you my little bit. Today, my talk will be basically it's an extempore talk, and I'll sort of divide it on my personal journey to how I made it today. And then I'll look at career options for students that are working at today and how community dentistry can work as a career for students, and given the current pandemic, what the future looks like. So I'll just start with my path as to how I reached here today. I graduated in 1992, so I've been practicing for now more than nearly 30 years. And in my time, girls were very few. We were in a class where there was gender ratio, so 1/3 girls and 2/3 boys. And girls were still in the time where we were very subject to cultural demands of marriage and children. So I got married while I was a student. And immediately after graduation, I did what most women do, and that is have children. And then I started my career after my children were born. So I always say this, and I'm going to bring gender a lot in today's talk, because about 80% of our average class in Pakistan today is girls. And girls face different issues in their careers. I always say you cannot compare a female dentist's career to a male dentist's career. It's like comparing apples and oranges. So I'm going to focus a lot on the gender. And because I feel the girls of today, the women dentists of today, are facing multiple dynamics and far more than their male counterparts. So I basically, in our time, the stress was on, BDS training was stressed on becoming a great clinician. So versus today's training, which is basically they stress on a lot on postgraduate training and research, and they just assume that your clinical skills will be developed by the time you finish your house job. And it is here that I quite disagree with a lot of my fellow colleagues, where I say that there is no hurry to start career. You have become a dentist. Your first and primary calling is to perform dental procedures to the best of your abilities and for the best results for your patients. A dentist is first a doctor, is an engineer, is an artist, and then we have everything else following us. So somehow in today's career guidance, we keep talking about post-graduations and we keep talking about do this and do that and do this. But we seem to forget that our dentists are not, we just assume that the dentists are going to be good clinicians. And good clinical skills do not come with just a 4-year BDS and a 1 year of house job training. Good clinical skills comes simply by working and working and working. It is years of experience that gives you good clinical skills. So I always feel that today's children I'll refer to all the graduates as children. Today's children are immediately after house job are suddenly confused. They just don't know what to do, and they are bombarded with so many opportunities. Do an MDS, do an MCPS, prepare for your part one, go do your ORE, and they just forget the fact that they've become dentists, and they need to first hone their clinical skills. So I always advise after your graduation, please attach yourself to a clinical setup, be it a hospital, be it be it a hospital, be it a private practice. But once you start doing patients, you will then find your passion. It's very easy to say, find your passion, but how do you find your passion? Maybe you think, I love endodontics, but you end up doing 6 root canals in a day, and you say, no, this is not my calling. So when you have worked for about 2-3 years, you find what are you excited about? Does prosthodontics excite you? Does orthodontics excite you? And that way you can actually carve a career path out. So why I did dentistry is because I wanted to do art. And it is only, and I had a choice between going into MBBS and into BDS. And at that time I took BDS, which was not a good thing because everyone thought that if you were bright, you went into MBBS, and if you were not, you did BDS. We were always considered second-class citizens. But BDS was my first choice. And it's later on I found out that it has a very cosmetic and artistic element to it, and that therefore fulfilled me. I also found out that it can be a very, very tiring profession if you just are in clinical practice. I did clinical practice for 11 years, and then I think I burnt out, and that is when I went for my master's. So I'm one of the few people who just lived on a BDS for the first decade of my career. And on burning out, I wanted to do anything that was not clinical. And that is why I went for a completely different field of public health. So what did public health do for me is that it opened so many doors. It opened so many doors that I am still opening doors. And public health, I did a master's in public health, which is a generic public health, and which today PMC is not recognizing, and is saying that all dentists can only do a master's in dental public health or an MPhil in community dentistry. So that's another topic. That's a topic I won't touch today. Okay, so how did I go to Harvard? Harvard was, Harvard admissions are very much based on, unlike Pakistan, they're based on a well-rounded application. They don't want to know that you were the gold medalist. They don't want to know that you were the topper of your class. They don't want to know that you have gotten distinctions in this subject and that subject. But what they want to know is, are you an all-rounder? You need to be good in your studies. You need to be good on in the public sphere. You need to be good in activities. Are you doing philanthropy? So there's a whole wide range by which they select you. So it's not only the basic assumption is you're really, really brilliant to have gone to Harvard, but that's not really true. You sometimes find some very average people in Harvard, but then because they're such well-rounded personalities, that well-roundedness is the key to success. So our students today are focusing a lot on, it's a very targeted, narrow focus that we go. I'm doing my BDS, and I'm going to do my FCPS, and then I'm going to do my medical education, and then I'm going to do this, and I'm going to do that. I urge the students not to be so focused. Success in the 21st century is never going to be in one arena. Success in the 21st century is going to be when you have touched other spheres of life. So you can wear many hats at the same time. You can be an orthodontist, you can be a professor, you can have a clinical practice, you can do cutting edge research, you can do many things with one, standing from one arena, like I did. My primary arena is the clinic, and then I have hands in the UN world where I do projects. I work with the HIV, this thing. Then I do research on qualitative research on women, gender, poverty, social exclusion with international universities. And at the same time, I haven't given up helping the poor and vulnerable of our country. We need to give them their, we have to give our due to the less, the poorer and the ones who deserve us. You can't stay in this world and take everything and not give anything back. And your giving back has to start now. It doesn't start when you're going to be rich. You can give back in many, many ways. Okay, so when I look at the career options for students today, I will say you are, decide what do you want to do. Do you want to go into academia? Or do you want to go into clinical practice? Once you make your decision, what drives you, then you can choose what are the post-graduations you want to look for. For example, if you want to go for academia, you want to teach in a college, and you want to grow your path from demonstrator up till the dean of the university, then you choose degrees which are PMC approved. Like, you have to go for nothing less than level 3 qualification. Whatever your specialty is, whether it is basic sciences or clinical sciences, you choose a specialty which is level 3. And with that,
I think Dr. Rubina is muted. I can't hear.
all right. Sorry, am I back on?
Yes, you are back.
I think this screen is touch screen. I must have touched it. Okay, so if you want to choose academia, then all the advice that Professor Azad gave, that is a fantastic advice. That's all for clearly academic careers, and those are so many options that he's given you. If you want to go for clinical and you want to focus yourself on only clinical growth, then you are basically looking at towards setting up a practice or working in a joint practice. And setting up a practice is a completely different ballgame. For that, you don't need level 3 degrees. You can have several smaller diplomas, or you can have MSCs in, say, cosmetic aesthetic dentistry, MSc in restorative dentistry, or if you want to specialize, then maybe an MSc in periodontology. These are smaller degrees which are level 2 by PMC and will not let you go far in academia, but they will give you skills, clinical skills to hone in your clinical practice. And a clinical practice grows by only one factor. We talk about marketing, we talk about social media, have a fantastic place, it needs to be pretty, it needs to be in a very good location, and all those things are there. But the greatest marketing factor for a good clinical practice is your work. You do good work, people will come to you. There is actually a formula known by the 7 to 3 formula. I don't know if people know about this. If you do good work, your patient will praise you to 3 people. If you do bad work, your patient is going to badmouth you to 7 people. So once you keep the 7 by 3 formula as your working motto in your clinic, and if you do something bad, you have to bend backwards to make sure that patient is satisfied. So nothing is a better marketing skill than having your work, your clinical work speak for itself. So these are the, then there is this other option, other than academia, other than clinical, which comes under different categories, and that is called administrative work. And administrative work you can always take up at any time. You don't make that your key career path. That can be taken up at any time, depending on what opportunities open for you. All right, so now when we look at community dentistry as a career in Pakistan, you know, I did an MPH. So with an MPH, I could wear many, many hats. Unfortunately, these hats are now doesn't allow me to wear it in the academic world. I'm lucky because I made it up till this point, and now the PMC has decided MPH cannot teach. So the new generation needs to do a master's or an MPhil in community dentistry, which limits you to a career currently only in the academic world. And if it limits you to a career in your academic world, then an MPhil or an MCPS in community dentistry is insufficient. That's a level 2 degree, which will take you at the most up to an assistant professor. At the rate PMC is going, you do need a level 3. So you need a PhD in community dentistry if you want to grow in the academic career of this subject. So anyone who wants to enter community dentistry at this stage should be mentally prepared that the initial master's is just a stepping stone. It has to lead to a PhD. Otherwise, your growth will stunt at assistant professor level. And community dentistry as a post-graduation plays absolutely no role in your clinical practice. However, I have worked with the WHO. I was the federal coordinator for the oral health component with WHO and the federal government. And our first aim was that we do not have an oral health policy in the Pakistan health policy. This is something that we've been working on for very many years, and we've been unsuccessful because there is no political will. So if the new generation wants to enter community dentistry, then they can enter it at a level and become the driving force to make this policy change at a government level. And I think the new generation has the drive for that sort of advocacy. However, given this drive can now catch a lot of momentum because of the pandemic. The average policymaker, the average politician is also very willing and very welcome to this sort of information. So this is actually the right time if we can bring the oral health policy, if we can bring oral health into the Pakistan health policy, which is something that I am working on. So if anyone is interested, can contact me, and I need a team. Basically, I need a big team to push this at this point. So with the pandemic, I feel that community dentistry has this opportunity to come into the forefront. It has been a very minor subject. It has been a very neglected subject. It is considered unimportant, but the pandemic, I think, has lent it importance and credence. But for that to manifest in reality, we need the new generation. We need the drive, the power of the new generation to push it and take full chance of this opportunity. Okay, as a passing, let me end my extempore. I don't know what I have talked about, but let me end it by advising the new graduates, please carry out this personality test known as the Brig-Myers test. The Brig-Myers test tells you what are your skills and how you can choose subspecialties and career paths based on your intrinsic personality. I did the Brig Myers test when I went to Harvard a whole decade into my career. And luckily, I found out that my personality is best. My major is that I like to work miniature, which made dentistry a perfect career for me. So by default, I entered into a career which my personality was made for. And my minor personality trait was research, my curiosity, my attention to detail, which made my public health degree the best option. So I found this out about 10, 12 years after graduation. You can do it now. Do your Brig Myers test and find out what your personality lies for. And then with your BDS, that's just your basic training, you can carve your path out in whatever options are available. Okay, so I think I've done my 20 minutes. I can talk much, much more, but I think Dr. Sanaa will now stop me and I'm ready to take questions.
Aslam. Yes, audience, we have some questions for you, ma'am.
Assalamualaikum.
Walaikum salam.
First of all, I just want to say that it's absolutely amazing meeting you. Just to have so much in your life. Better? Gotcha. Ma'am, does that echo? Okay, I have like a bunch of questions to ask. So the first question I'm going to ask is, when you were talking about Ivy League universities and looking for Okay. So my first question is, you were talking about how Ivy League universities look for a well-rounded person. So I would like to know if what qualities, for example, I do a lot of social work. I have a side business as an artist. So do things actually help in your application if your grades are just average? Do they make you a good candidate for application? Because I have been afraid of applying to these places because my grades are not that good. Oh, okay.
You have to say it all over again.
Okay. Ma'am, can you hear me? Hello?
Ma'am Rubina?
Yes.
Okay. Ma'am, could you hear me? Should I say it again?
What I understood from your question is that you want to apply to Ivy League universities, but you're not doing so because you have average grades. Is that right?
Extracurricular activities, a lot of social work I've done over the past like 10 years of my life, and a lot of artistic work as well. So I want to know if that would make me a stronger candidate for applications.
Oh, yes, it would. Oh, yes, it would. Having done a lot of, having put your fingers, made them wet in different aspects, different arenas other than your primary dental, gives you an edge in your selection process.
Okay.
Of course, your grades will play a role. And then if you apply, you'll have to do the GRE exam. The GRE will have to, so your basic amount of English, maths, and logical reasoning and writing skills has to be superior.
Yes.
Because GRE tests you and all that. But if your maths is poor, you can still go in because depending on the degree you're looking for, depending on the master's degree. Like when I applied for master's, my maths was poor. The last time I did math was in O levels. So I had completely forgotten maths and I got a lower grade in my maths, but I got a very high grade in English and I got a full grade in logical reasoning and writing. So when I got into Harvard, my name was one of the 25 names of students who were supposed to take maths tuitions for 2 weeks. So at the beginning of the class. So that shows that although my math grade was low, but everything else was fine, I still got admission. So I will advise you, please apply. There is no harm in applying and highlight all your other work and highlight it in a manner that kind of overshadows your average grades.
Yes.
And give it a shot, give it a go.
I have another question as well, ma'am, about public health. I was confused about, like, as a pathway program, taking medical education or public health. I was thinking of medical public health because it's a very versatile degree and it lets you do a lot. You can get a job as a biostatistician, epidemiology, and I like research as well. But because of the PMDC's new guidelines, you can't even be a senior lecturer with an MPH degree. So you have to either choose to be an academic character in community dentistry only, or just do MPH. So is it intelligent to do MPH just for the career prospects as a pathway program or not?
As a career pathway program, you're asking if you want to do medical education?
No, medical public health. From you, I would like to know about medical public health at this point, because it won't be helping me in PMDC or PMC at all.
Well, if you do, it's not called a medical public health, it's just called a master's in public health. The dental one is called the master's in dental public health. That's the difference. Okay, so if you do an MPH, it will not, no doors will open for you in the academic world. However, if you focus on, say, biostatistics, we lack biostatisticians in a big way. We can't find biostatisticians. And because research is now one of the biggest things in all academic institutes, we all want research. You can, as a starting path, you can work as a biostatistician. That will be the admin part of your career. But that means also that you will be diverting away, digressing from your main dental career. But as a stepping stone, it's not a bad idea. But remember, with your MPH, other doors will open, but the dental academic door will be closed. So the choice is yours.
Thank you so much.
The other doors that can open are UN, NGOs, very many other doors.
Assalamu alaikum, ma'am. Ma'am, my question is, how did you build your CV during those 10 years that you talked about? Like, what's the magic formula? Did you do a lot of research, or what? How exactly did you build your CV during that time?
Okay, during those 10 years, I'll tell you that I did a lot of philanthropy. I did a lot of advocacy. Without realizing I'm doing public health, I was the advocate for oral health advocate for different schools, different orphanages. I worked with the women prisoners and the babies that are born in prison. And I worked on the education of the children in the prison. You know, this was a very passionate thing. These women prisoners get molested by their guards, and they end up getting pregnant and having babies, and those babies are actually born in prison and live there. And you have these 5-6-year-old children who have never seen the world and don't have any opportunities. So I work with women prisoners and their children. And then I actually worked in, like I said, in BHUs. I went to local BHUs on the outskirts of Islamabad and in near Lahore, and I would do dental work in BHUs, because in Pakistan, in our healthcare system, the dental clinic finishes at the RHC level, the rural health center. It doesn't come down to the basic health center. So I thought that people come with issues, dental issues, and at BHU level, and they don't get treated. So I went and I would do primary dental health care, which is basically just an extraction or a temporary filling or glass ionomer, ARTs. And I would do that without realizing that what I'm doing. It's only when I started applying for the university, I realized I've done all these things. And then, of course, I was often invited by, I was at a time when I was the first solo female practitioner of Islamabad. And then I would get invited by TV shows to talk about oral health and all. And by default, I also had media experience. So I think in those 10 years, just doing things that I enjoyed doing, build up a CV without me realizing I'm building a CV. But I would suggest you can do all that now. Look for NGOs that are working, look for specifically vulnerable populations. That really works well with Ivy League. If you've done something for the vulnerable, it reflects very strongly, especially if you're going into dental public health.
For your time, and your contributions.
Thank you, ma'am. Our next distinguished guest speaker is Professor Dr. Joharia Azhar. Professor Dr. Joharia Azhar is a professor in oral pathology and medical education, a consultant laser dentist, cosmetologist, and esthetician. She graduated from Liaquat University of Health Sciences in 1999. She then proceeded to UK for MSc in oral pathology from Queen Mary University in 2004. She pursued MPhil from NUST in 2008 to 2010. She then proceeded to Germany Aachen University to undergo extensive training in laser dentistry and received the prestigious fellowship in laser dentistry from the similar university. Afterwards, she joined MHP program and became a medical educationist in the year 2015. She then got promoted to associate professor in 2014, worked in Islamic International Dental College as an assistant professor and head of department of oral pathology. Then after her MPhil, she joined Margila Institute as head of department of oral pathology. In 2012, she joined Ahmedabad International Dental College. In the year 2015, she was offered a prestigious academic position in Princess Noor University, Riyadh, Saudi Arabia, where she joined as professor in diagnostic oral sciences and chair of the Department of Dental Education. She returned back in 2020 and has joined Ahmedabad International Dental College again as vice principal. Please, respected ma'am, Joharia Azhar, you are open for your talk now. Ma'am, can you hear us?
Ji, Assalamu alaikum. I can hear you loud and clear. I hope everyone can hear me.
Yes. Yes, ma'am, we can hear you and see you.
Thank you so much. First of all, I would begin with thanking Dr. Rozina and her team, Dr. Sanaa. Dr. Sanaa showed utmost patience in trying to reach me again and again. I was extremely busy during the past few days, and it's a very nice session, very interesting one. I've been listening to the talk since morning, and I think many things have been covered. And also it's a cry of the day sort of a session, because I do come across many young dentists and students who seem to be totally confused regarding what they want to do or how they want to pursue their careers further. We've heard a lot of things about, the different specialities of dentistry. There are 9 or 10 specialities, then there are different domains of dentistry. And we do know that dentistry is a very versatile field, and that it's sort of a amalgamation of art, science, and then business, of course. So not necessarily a profession for those who are only interested in the health sciences, because it has got a very strong business factor or business aspect as well. And then there is art of it as well. Now, pointing these things out, I also would like to, sort of advise all the young students and young dentists that although it's good to be focused, you don't have to be too focused. And I would like to say this to you by giving you my own example, since I think it's again an extempore talk, so I apologize if it feels a little haphazard to you. I would like it to go like a sort of a story, the story of my life, and then, a few lessons that can be drawn from it. I came into dentistry as a sort of an accident. So that's why I was telling you that it's good to be focused, but it's not necessary to be too focused. And if your plans do not turn out the way you want, that also does not mean that you're not a successful person. See, success is also a very abstract concept. You really can't have a criteria of success. Success can be anything in which makes you happy and satisfied and grounded in your place or in the space that you are. So that's what success is, and that's what I would advise you all to pursue actually. Thirdly, being females, many things come into it, as Dr. Rubina very rightly pointed out, that being a female, it's not only your career that you have to focus on. You have to focus on a number of other things. Like I got married in my third year. I was pregnant during my third prof, and in my final year, I was with my daughter when I went up on the stage to get my degree and a gold medal. So all things, they can happen simultaneously, and at the end of the day, you will see that if you are persistent in your efforts and you are sincere to your motto, you'll succeed. I started with LMC from where I got actual admission in MBBS. So I am a case of an accidental dentist. I mean, I got admission in MBBS, and after the first fortnight, I realized that it was too much for me. The night duties would be too much for me. And I decided that I wanted migration from MBBS to BDS. At that time, in the year 1999, it was allowed in our college. So I applied for a mutual migration, and I mutually migrated to the BDS class of that session. Many people told me at that time that, oh, you are committing a big mistake, because, dentistry is considered, was considered at that time slightly lower than the MBBS. And people told me that you're committing a big mistake, but it was a decision that I had made, and I stick to it. Another important thing is, if you make a decision, then it would be better always to stick to it. And at the end of the day, you will find success. Right. So when I came into dentistry, again, I had to put my family, which was preference. So my house job was delayed. I graduated in 1999, but I could pursue my post-graduation in 2004. So to all the females over there who are worried about these things, I keep on getting these questions that I have got a baby, I am not working at the moment, how will I survive? How will I get back into the profession? My advice to them is that you can always jump right back in. So I gave, you can say, a hiatus from the, I got a hiatus from the profession from 2000 to 2004. It was only in 2004 that I applied for postgraduate qualification. And again, because of the basic sciences degree in oral pathology, I came into the clinical sciences. I then opted for an MPhil, but my MPhil was again because of my passion in immunology and virology. Now, this was the year 2008. Again, I heard that what are you doing in the field of immunology and virology being a dentist? But as you can see that, especially in the current scenario, the corona epidemic and all that has revealed the importance of these allied sciences, virology and immunology too much. I stuck what I liked in these later degrees, and that has brought me immense satisfaction because I am among the few virologists in Pakistan at the moment, and especially with the dental sciences background. So it's always good to pursue your passion, no matter what people say to you, or no matter how you feel that this might not reward you. Things usually end up rewarding you in the longer run. So after this, I got interested in dental lasers because they were a tool that could be used to treat various oral pathologies. known and discovered, but a vast majority of viruses remain undiscovered because we don't yet know their genetic codes. So how important these allied fields are makes us wonder that is it really wise to just be sticking to the 4 or 5 specialities that we are shown to and not the others. So it's a whole large sea out there, and I would also advise everyone to actually look into what the foreign countries are doing and the type of programs that they are actually offering. So there's geriatric dentistry, there's conscious sedation, there's sports dentistry, regenerative I can't really count the challenges and opportunities because challenges are too many, and all the females sitting over here would understand it, and the males would try to understand it. But we know that that's a topic for another discussion. We might need another hour for that. But the message is just that if you are sacrificing your professional life for your family life, it's all right. You will be compensated for it at the end of, and not exactly at the end, but later onwards. Like for example, I did not do anything professionally for the first 3 or 4 years, but that did not hinder me. I feel when I compare myself to my other colleagues, I think I'm almost at the same level as the rest of my class fellows or the male class fellows especially were. Although they did not, none of them sacrificed 3 or 4 years for their family, but I had to being a female. I mean, the females have to. So it's okay to take time out for your family. It might slow you a little bit, but you will be compensated for later onwards, as long as you jump right back in and have perseverance.
So much, ma'am, for your time. We are highly grateful.
It was a pleasure to be here. Thank you so much to all of you, and enjoy the rest of the session. I really have to run now. Bye.
Thank you so much, ma'am. Our next distinguished speaker is Dr. Amber Kiyani. She graduated from Prof International University in the year 2009. Following her house job, she proceeded to undergo residency in oral and maxillofacial pathology. Dr. Amber completed her residency training, graduate degree, and requirements for the American Board of Oral and Maxillofacial Pathology in 2014. Since her return, she has been working as an assistant professor at Prof International University. She will be talking about a brief overview of international postgraduate training in clinical sciences. Dr. Amber?
Assalamualaikum. I hope I am audible.
Yes.
Okay, I'm very grateful for this opportunity to speak in front of you all today. We've had some splendid talks, which I hope I can add something to. Now I'm beginning to think I should have asked you guys to let me go first, because of all the accomplishments we've discussed today, I think mine are the smallest in quantity wise. But I'll try to put in my 2 cents there, and hopefully you guys take something out of my small speech today. I'll try to wrap it up. I know we're way beyond our time limit. So after completing dental school or house job, we all reach this stage which is known as a panic mode, because none of us know what to do. What I want you to understand is that I still go through them, and I'm in my mid-30s. Okay? At times, I feel despite having been through a significant journey myself, I'm still unsure of where it will lead me next. But I think that's life and something that we can just get used to. So despite this being a very uncertain time, you have to make your decisions, and you have to make them according to your circumstances, and you have to understand that your circumstances are unique. Mine were unique, Dr. Rozina's were unique, Dr. Rubina's were unique, Professor Azad's were unique. So everyone has their own circumstances according to which you make your decisions. However, there's one thing that I would like to stress on is that you need to have a destination. I tell my students that you need to know if you need to go to Peshawar, Lahore, or Karachi, right? Once you have a destination defined, you're going to figure out, okay, I can take the plane, I can walk, okay? Because for some people, it takes, the normal route takes longer than usual. Like Dr. Joharia was saying, she took a 4-year hiatus because she had kids, right? So all of us have our own journeys, but we need to have a destination in mind before we're taking the car or the plane or the train, okay? Or maybe the Concorde, depending on how your journey is planned. So, however, if I talk about myself, because I was asked to discuss everything in the light of what I've been through, because most of my education was in the US, I think I'll be able to address that a lot better than other countries. I decided in third year that I was going to pursue oral pathology. I was very fortunate to have great teachers like Dr. Joharia, who just spoke shortly. There was Dr. Azhar, Sheikh, Dr. Aslam, and these were really people who kind of fueled my passion. And England really wasn't an option for me, so that left me to explore the US as a possible option. This was, of course, uncharted territory because no one really goes to the US. No, not a lot of people do. So I didn't really have a lot of guidance when I was sending in applications. I applied to two schools, and I'll talk about how that worked out. So when you're considering a dental profession in the US, you have one of three options that you can choose from. The first one is that you go to school, which is you attend their dental school for an additional 2 years. That gives you a dental license. This is known as the Advanced Placement Program. And for any of you who plan on living in the US long term, this is the only option that I would recommend for you. Okay, because you need to have a license in order to do anything. Okay, the second step that you can do, you can either apply to it directly. Of course, your options are limited if you're applying to it after BBS. Allows you to do a residency program, which is like FCPS training. I think in the best way that I can explain it. Okay, so it's a 2 to 3 year training program, depending on the specialty that you choose. It qualifies you to get a limited license to practice, which is that you can practice in the specialty that you're doing your residency in only, and that's only for a few states as well, which is why I was stressing on the fact that try to get a license first. Okay. So if you're lucky, you can get an academic position and they let you practice through your specialty too. But you cannot do general dentistry and you're not licensed as a dentist in the US, even if you hold these two licenses. The third thing that you can do is the path that Dr. Rubina talked about in great detail, that you can choose a field which is public health, or maybe some other maybe basic dental specialty. Or pathology, by the way, is not considered a basic science anywhere else in the world except for Pakistan and India. I think they do that too. So I chose the residency pathway. I applied directly to the residency program. It's of course a competitive program, and you need to prove that you are worthy. Okay, so how do you prove that you are worthy? One of the first things is that you need to have a good academic record. Now, I'm not saying that you need to be the first, like stand first in your class, but you need to have a decent academic record. One of the ways in which we prove this is that they do a grade conversion. Like they convert your scores into the grades that you might have gotten in the US. This is called the EC evaluation or the WES evaluation. There are multiple types of it that you can get done. So that's how you prove that you have a good academic record. And one of the other things that's important is that you need to have clarity of purpose, which is why we're talking about the destination. You need to define where you're headed first. So your statement does not need you to talk about how underprivileged you were because you grew up in Pakistan. You're a dentist. You're not underprivileged. Okay? So you talk about what you want to do. You need to have clarity of purpose. I'm doing this not because I rolled out of bed and fell down and decided that I want to do this today, but because you actually have a strong passion for the field that you're trying to pursue. One of the third things that you need is good letters of recommendations. You need people who believe in you, who are going to try to prove that you are better than you actually are. Okay, and they're going to go the distance to prove it. I was very lucky. I have a lot of professors who believed in me and wrote me excellent letters of recommendation. After I got in, my statement of purpose and my letters of recommendation were pointed out as two things that made me a yes for them. So remember that these are some of the most important things in your application. Okay? It's important to have a research background. It's a definite plus. I did have a couple of publications before I applied, but it's just something that looks really good on your CV, okay, or your application. The reason for this is that the university is giving you admission, but what are you giving the university? If you are introducing yourself as someone who's going to do research for them, that raises the university's potential, right? That's something that you're doing for the university. So you need to give a little bit back. And with your research experience, at least you're implying that that's something that you can give back. So in most programs, they're going to also require you to take the National Dental Board examination, which was initially a two-part exam, but now it's only a single exam that you take at the end of your course. The US people take it at the end of their 4 years of dental school, but we can take it after dental school as well. Now it's a single one-part exam. It's called Integrated National Dental Board exam. It's actually a very fun exam. It's all about treatment planning. I actually did a practice test and I was excited. So I don't think it's a really tough exam to take. If you're good with what you've been taught, you're gonna ace that exam very easy. So clinical skill training programs usually require you to have some sort of clinical training. Dr. Rubina made an excellent point on how important it is for you guys right after graduation to get some practice in the community. You need to know how to work as a dentist before you go on and specialize. Okay, because a lot of these things are going to present themselves over and over again. I had a patient yesterday who was in extreme pain, and the reason for his extreme pain was not because he had an oral pathology, okay, or an oral medicine problem. The reason was because he had periodontal disease. So if I did not work as a dentist, I would not be familiar with all of these, right? Because the general oral medicine practice requires you to look at interesting lesions all day. But I did practice as a general dentist. I did my house job. I did a year after that of general practice in private clinics. I went through the whole role of what you're supposed to do, right? So because of this, my diagnostic skills are better than what you would expect for someone who did not do general practice at all. So once your application is through, usually they have a small filter out period, and then they contact you if you're shortlisted. And when they contact you, they expect you to go through an interview. Now this interview is thorough, right? They want to know what your superpower is. Okay, they ask you about your strength, they ask you about your weaknesses, like they ask you about what you wrote in your statement, okay? I'd written about, I was going through a competition at that time. It was a research competition that was taking place in Karachi. And they asked me what the results were. So they're vigilant about anything that you said in your statement. The interview was 1.5 hour long. It was on phone, okay? My call. That was my money being used too, by the way. Just stressing there on that point. So 1.5 hour, they grilled me. And after that, I got a few questions from them. I got to speak to the residents who were already in the program. So it's basically a 2-3-step interview. And after that is when they offered me a position at this university. So this was one of the two schools that I applied to. I heard from them first. I accepted the position, so I didn't even try interviewing for the other one because I knew that I was gonna be very grateful if I don't take this opportunity right away. The residency experience was great. I was very lucky that my mentor, Dr. Carl Allen, is basically a guru of oral pathology. There's a book, Neville and Dan. He's one of the authors on it. So a very kind person, a very modest person. I was very lucky to train under him for 2 years. And he's great clinically, so I got a really good clinical exposure during my program. He's great in histopathology. He's retired now, so that's why I'm talking about him in past tense. He's still alive, but he's just retired. So after that, because I really enjoyed teaching to begin with, I continued with applying for jobs in academia. My intention was to come back. So I did not pursue job opportunities there in the US. However, I am eligible to apply for jobs because I did write my American Boards of Oral and Maxillofacial Pathology, and those are cleared in 2014. So that makes me eligible for specialty practice in the US in, I think, 7 states. And if I get a teaching license, then I can practice pretty much everywhere. So this is just a quick overview. If you have any questions, I can address them specifically. but I think I just went over my 16 minutes. So I'm going to end this and I'll just take it from whatever questions that you all have. You have a lot of questions. That's good. Okay, that's good. You have a lot of questions. It's good to be inquisitive.
Okay. I'm just looking at all the options, and I want to find something that's fun.
It's good. You have people to talk to. I'm happy I can help out in any way.
Okay. So I didn't really know about this second pathway that you told me about. So I had this didn't think about US as an option. So I'm glad that you told me about it. The residency program, I'll look into it. First cost. And second, did you use the ECE route or the WES route to get your degree?
ECE is more acceptable in the West.
Okay.
So that's the one that I use for my evaluation.
Does it matter like your grades are just average, but you have like all the other?
So I'm talking about age history because you have to remember I graduated like 20 years ago. But in those times, they would consider anything 6 plus as an AA. So I think you're going to be fine. I think you're underestimating yourself.
Okay, that's fine then. That's fine. And the very realistic question, which I'm just going to ask you, cost-wise, how did you manage the cost of it?
My resident program was all paid for. The university selects only one resident. They pay your tuition for graduate school, and they give you a small stipend for doing university responsibilities, which include teaching, grossing, participating in university life service, and supervising students. So, yes, but that's not how it works everywhere. I was just super lucky. Okay. So in some programs they offer you this option, and some don't. Okay. But look for programs that do offer this for international students.
Okay.
And if you can make an impression, they will go for you. That's
and which university did you apply to?
I went to Ohio State, and the other university I applied to was Baylor School of Dentistry.
And then
Baylor School of Dentistry, because the program director was very friends with Dr. Allen. So when Dr. Allen offered me a position, they just emailed me and said, if you're accepted at Ohio State, you just drop your application. And I said, sure.
Okay. And if you don't have research publications at the moment, but you have ongoing research projects, is that all right?
See, so you can list as your research experience on your CV. They still count as research experience. Of course, published data is great. That's great information. There's nothing that beats that. But there is a section on your CV that goes in as research experience. So what you have to do in that is this kind of research work you're doing, what your responsibilities in that research project are, and then you specify the name of your supervisor. And list your supervisor as one of the references. So your supervisor can justify that it's my fault that this data isn't published yet. Okay, and people do that. I do that with my students sometimes.
Okay. And I have one confusion is when did you do your NDD? You did your NDD you just applied straight from BDS house job and 1 year clinical experience.
After my house job, I applied. I was exempted for the DBE as well. It wasn't INDB then; it was NDB at that time. But I was exempted for it. They asked me for some sort of standardized scoring so that I could prove that I can do graduate education in the US. I had a GRE at that time. I sent those scores in, and they didn't ask me for the national dental boards after that. So they compensated their requirements. See, I told you, if you make an impression, they're going to make compensations with you.
And you did your licensing exam in your specialty. That's the only licensing exam.
The boards for my specialty, that they did right. I wrote them, because I was eligible, you need 3 years of residency for it. I did 3 years of residency, and I could apply to take the specialty boards.
Thank you so much. Thank you. Thank you so much, Dr. Amber, for joining us and
enlightening all of us.
Thank you for the opportunity. I appreciate it.
I'd like to request Major General retired Jawad, Khaliq Ansari to say a few closing remarks.
Bismillahirrahmanirrahim. Thank you very much. Dr. Rozina, very grateful to you that you arranged such a wonderful session for our graduates and students. This is probably the first only webinar which I fully attended. In spite of being clinician and have been offered to speak on many webinars and attend, because I think the webinar or IT-based teaching or learning is not, it can be complementary, but it can never replace the physical interaction and sitting in a conference room and all that and speaking to. I appear कि मैं normally जिन्होंने मुझे सुना है तो normally मैं English और उर्दू दोनों को mix करके बात करता हूँ और at this point in time and I'm in zooming out phase of my life and fading out. Practically, I can only share with certain traits which can make you bring some success in your life, which I have learned. मैंने काफी सारे पॉइंट लिखे हुए थे and जो टेक्निकल पॉइंट हैं वो तो आप सब लोगों ने बहुत अच्छे कवर कर दिए और जनरल पॉइंट जो थे वो डॉक्टर रुबीना ने बहुत अच्छे कवर कर दिए तो जैसे जैसे वो बोलती जा रही थी तो मेरे सारे पॉइंट करते गए और आई एम लेफ्ट विद ब्लैंक पेज नाउ एंड शी स्पोक वेरी वेल. सबसे पहले मैं आपसे बात करूंगा चंद प्रिंसिपल्स पे. फर्स्ट थिंग इज दी व्हाट आई लर्न that in your life and your career, adaptability is very important. You have to adapt whatever comes your way. और मैं उसको पर्सनल एग्जांपल आपको दे देता हूँ and everybody can learn their own lesson from that. I was born in a very small unprivileged family in Bhutan, but I happened to be somehow intelligent, smart enough to go well in education. And जब मैंने FSC की in a very good marks, तो I wished to be an engineer, but there was no engineering college in Bhutan. So there was only National Medical College, and I have to be a doctor. और जब मेरा एडमिशन हुआ तो उन दिनों के लोग हैं वो जानते हैं कि there used to be a central interview in Lahore to centralize admission in medical college. That used to be done in public medical college in KE. And all principals used to sit there and I was interviewed because I was the first one. I was offered admission in KE and I told them that I have to be in Bhutan. And because I have to support my family and to learn as well. Later I came to know I could have accepted admission in KE and then swapped and sold my admission to somebody by getting 50,000 rupees at that time. अगर आप म्यूचुअली एक्सेप्ट करते थे तो I lost first opportunity at that time. Anyway, then I came in third year and suddenly there came a situation where they were offering induction in Army Medical Corps in third year as medical cadet. We were few and because I wanted to be quickly on a financially strong. And I never knew at that time that CPS कोई होता है और post graduation भी कोई होता है. I just wanted to be a doctor and earning as quickly as possible. And the first candidate period, it was me and I accepted the offer and then they gave me 8,000 rupees for the first 3 years of 300 महीने के कि ये आपका पुराना हिसाब है आपने 3 साल पढ़ा है तो in 8,000 rupees that was the first motorbike I bought. कि चलो ये पहले मोटरबाइक तो खरीद लेते हैं ना. And then we kept on studying in Asst and then the result came and we joined CMH. जो important thing है मैं आपसे रिलेट करना चाहता हूँ कि जब हम फर्स्ट ईयर सेकंड ईयर में थे तो हम डेंटिस्ट्री और हम लोग इकट्ठे पढ़ते थे. Anatomy, physiology, chemistry. So from the very beginning, we were very. I have more friends in BS program than even in MBS program. So इसलिए आप कह सकते हैं कि मैं emotionally और somehow connected हूँ. और वैसे हमारा curriculum भी common है. इस तरह से आर्मी में I want to be a neurophysician and I turned out a physician. And then at one point in time, at hardest time in my life, I was in hard area, which was very difficult to live, and I was offered, if you want to get postgraduate training in psychiatry, you can straight away come and join. At that point of time, I thought, no, I can't be a psychiatrist. And I have to be a physician, and then I have to pay the price. I stayed there for next 2 years in hard area, which was very tough in those days. And eventually, what I'm saying, you have to adapt whenever you are dealing with your career. There will be situations where you will not find कि ये ठीक है नहीं है. But if you adapt, everything will turn out to be good for you. And this is what I've learned, you have to adapt. Second one, I want to share with you what I see as a professional, what is happening in medical and dentistry. वो बड़े अच्छी तरह से प्रोफेसर रुबीना ने उसको कवर किया है, वो है आपका जेंडर. I think it is getting more and more female. They are rising and they are taking control of almost everything. और माशाल्लाह they are progressing a lot. लेकिन जो हमारी females हैं, I think इनको we know they are smarter than men. इसमें कोई शक नहीं है, because they are mothers, they are men. But I think what is happening, they have dealt with a lot of dilemmas. There's social dilemma, there's marital dilemma, but कई dilemma खड़े होते हैं. मर्द के लिए कोई dilemma नहीं है, जाके नौकरी करो और आकर खाना खा लो. तो और लड़कियों के लिए तो काफी dilemma है. और मेरा ये ख्याल है कि ये सिर्फ यही एडवाइस करनी है कि बस अपने ध्यान रखना है कहीं इस स्ट्रगल में जन्नत पाँव के नीचे निकल के आईपैड के नीचे न चली जाए या कहीं और न पहुंच जाए. और ठीक है ना, तो you have to preserve that jannat under your own feet. You have to adapt and you have to keep balance. And at the end of the day, as a parent, I tell you the only thing which matters is the good children. That's only pride you are going to have. Even if you are successful, one failure of your kid will bring devastation in your life. And your own struggle and your own achievement fall very short of that failure. एक तो आपने इस चीज को खास तौर पर आपने इस चीज का ख्याल रखना है. Secondly, I would like to tell you कि as a community में डेंटिस्ट्री को यूजर भी हूँ. As a community क्या चाहती है? I still recall I used to have a pain in my tooth. And when I was a child, the best dentist I've seen was my mother, who used to bring immediate relief at 2 a.m. With a long in her hand and used to keep in the cavity. And there was no paracetamol, practically. And the most fearful, so she was the kindest dentist I've seen. And that's why I am very comfortable with dentists as well. And the worst thing was when I saw जो dentist जो हमारे पाथों पे बैठे होते हैं, I used to always keep 10 feet distance from them when I used to walk कि यार ये दांत कहीं पकड़ के निकाली ना, जिस तरह से वो निकालते थे. तो that was extreme of experiences. तो आपने I would advise you to be a good dentist like my mother. And जो कि आप जब आप जाएं तो वो आपको दुआ दे आपका मरीज. मैं क्योंकि प्रैक्टिसिंग फिजिशियन हूँ, मैं समझता हूँ शायद वो दुआएं ज़्यादा अहम हैं. आपको एट द एंड ऑफ द डे कम्युनिटी नीड्स गुड डेंटिस्ट. एक और चीज जो मैंने नोट की है, somehow community satisfaction has disappeared. Are we really producing good doctor? We have a question. हम लोगों को सोचना चाहिए, खासतौर पर आज की लीडर्स सोचना चाहिए. What has gone missing? I think ethics और communications पे हमें ज़्यादा फोकस करना चाहिए. ये सर्विस ओरिएंटेशन से मूव करता हुआ ये प्रोफेशन, चाहे वो MBBS हो, चाहे BDS हो, has become career oriented और ये सारी चीजें. और मैं यंगस्टर से ये एडवाइस करूँगा कि वो ये देखें. एक और चीज जो मैं देख रहा हूँ, वो मेडिकल कॉलेजेस में देख रहा हूँ कि मुझे लगता है कि हमारी जो यंग डॉक्टर हैं वो सर्विस की बजाय टीचिंग उधर ज़्यादा फोकस होते हैं. मुझे लगता ये है कि शायद मेडिकल कॉलेज एंड डेंटल कॉलेज कम होते जाएंगे और इनमें एडमिशन आने वाले दिनों में बिकॉज व्हाट इज हैपनिंग जो मार्केट में जैसा होगा उसको वैसे ही लिया जाएगा। तो यू हैव वेरी वेरी केयरफुल टू चूज योर करियर कि आपने कहां प्रैक्टिस करनी है। द बेस्ट थिंग इज टू बी द गुड डेंटिस्ट, ताकि आप फॉलो भी करें, काम भी करें, कहीं भी बैठकर आप कुछ ना कुछ कर सकें। कम्युनिटी क्या चाहती है? एक आम आदमी ये चाहता है कि वो जब दांत दर्द हो या कोई तकलीफ हो तो वो डेंटिस्ट के पास फौरन पहुंच जाए और उसका वो रिलीफ मिल जाए और फिर वो रिलीफ जो है वो कॉस्ट इफेक्टिव हो, उसके पास में पैसे भी हों और थोड़े से पैसों का मतलब भी है आपके प्रोसीजर जो हैं वो इवन एट दिस रैंक समटाइम आई कांट अफोर्ड। तो इसको भी देखने की वैसे भी कॉम्पिटिटिव जब मार्केट आएगी तो ये चीजें नीचे जाएंगी। न्यू ग्रेजुएट मस्ट गेट रेडी टू गो इनटू द कम्युनिटी and a clinical dentistry जो है मुझे लगता है आगे इसका बूम आएगा, सर्विसेज डेवलप होंगी, आपकी गवर्नमेंट फोकस करेगी पब्लिक सेक्टर पर, प्राइवेट सेक्टर पर, तो आप अपनी ट्रेनिंग पे बहुत फोकस करें। अगर ट्रेनिंग आपकी गलत है तो आपका पहला मरीज जाके पूरे लोगों को बताएगा कि इसके पास नहीं जाना, ठीक है ना, और फिर क्लिनिक कब तक चलेगी, ना जॉब मिलेगा। तो आई थिंक यू हैव डन वेरी गुड और हमें एज ए टीचर भी फोकस करना चाहिए। हमें ट्रेनिंग में प्रॉब्लम आया है, हमें फोकस करना चाहिए बैडली ट्रेन्ड क्लिनिशियंस, चाहे वो मेडिसिन में हो चाहे वो डेंटिस्ट्री में हो, will produce badly trained doctors who will become master trainer again and they will be vicious circle of substandard clinical care. इसको थोड़ा सा आप लोगों को केयरफुल करना चाहिए, particularly जो डेंटिस्ट्री में प्लान कर रहे हैं वो जरूर देखें कि उन्हें जो उनके ग्रेजुएट आएंगे उनके लिए क्या अपॉर्चुनिटीज एग्जिस्ट करती हैं। एंड आई वुड से कि आपको अपने करियर में यू शुड बी रेडी फॉर मेनी अनसीन थिंग। अपने करियर में व्हेन यू आर इन द फील्ड यू विल मीट many people. You must be conversant with dealing with odds and adapting. ये मेरा आपका ये मैसेज है और खास तौर पर आप जैसे मैंने कहा है कि आपकी क्लिनिकल हैंड बहुत अच्छा होना चाहिए ताकि आप कुछ भी कर सकें। एंड देन फोकस ऑन योर होम, ऑन योर फैमिली, ऑन योर स्पाउसेस, ऑन योर चिल्ड्रन। ये नहीं कि प्रोफेशन में आप इन तमाम चीज़ों को बहुत पीछे छोड़ दें। आई विश यू ऑल द बेस्ट। खास तौर पर मैं तमाम स्पीकर्स दे स्पोकन वेरी वेल। आई वाज ट्रूली अमेज्ड बाय द कंटेंट ऑफ दिस देयर लेक्चर और मुझे लगता है कि वो आपके लिए ज़्यादा यूज़फुल है। मैंने तो आगे जाते थे कुछ कहना था तो मैंने कह दिया, अदरवाइज मे बी मैं आई एम द मोस्ट इररिलेवेंट हूँ आपके लिए, लेकिन मेरी आप दुआएं आप सब लोगों के साथ हैं। अल्लाह ताला खास तौर पर बच्चों के लिए, जो बाकी तो प्रोफेसर बन गए हैं ना, तो बाकी मेरा तमाम बच्चे जो पीछे बैठे हुए हैं, जो असिस्टेंट प्रोफेसर हैं, जो अभी आए नहीं हैं, तो मैं उनको ये दुआ देता हूँ कि आप सब लोग जो हैं प्रोफेसर बन जाएं और सब लोग प्रिंसिपल बन जाएं। अल्लाह ताला आप सबको जल्दी और इतने ही मेडिकल कॉलेज हैं, इतने डेंटल कॉलेज, ऑल द बेस्ट, टेक केयर।
Thank you so much, sir. As they say, smart alone, brilliant together. Collaboration is at the heart of everything we do. Having a shared belief in career guidance being the need of the hour for skilled dental healthcare professionals was a head start towards the cooperation from our esteemed panelists today. On behalf of FCD